Hi, everyone. Thank you for joining. We are just waiting for Zoom to admit everyone into our meeting. It can take, you know, 30 to 60 seconds sometimes. So I'm just making sure that Zoom catches up with us. Hopefully you can hear me and see our slides. All right. I think we're at a steady number here. Good afternoon. Thank you for being here. My name is Tammy Malm. I'm the Director of Education at PQA, and welcome to the July 2026 PQA Quality Forum. I'll be your host for today's webinar, and our topic today is integrating pharmacy into AI innovation and governance. Before we get started, I would like to walk you through a few housekeeping items. First, make sure to submit your questions during the presentation using the Q&A feature at the bottom of your screen. We will include your questions in our discussion at the end of this webinar. Also, the webinar recording and slide deck will be available to PQA members within about a week after this presentation. It will be in the Member Resources Library section. If you haven't already signed into your My PQA portal in our new website at pqa.org, please give that a try today and create your My PQA account. Should you have any troubles, make sure to contact one of us at PQA. Last, I would encourage all attendees to complete the quick 1-minute survey that will appear at the conclusion of the webinar. This gives us a better understanding of what kind of content you're looking for us to present to you. So PQA has an interest in the use of artificial intelligence because our members and stakeholders are using it to identify, engage, and support patients in their medication use. This webinar is in part a follow-up to the PQA Convenes event that we held last fall. We will post links to the blogs that were written about that event, and today we are excited to continue the dialogue around AI and in this space. It is my pleasure to introduce you today's speakers. First, we have Anthony DiDonato, who is a program manager at the Coalition for Health AI. Also with us is Jeff Rochon, executive director at the Pharmacy Health Information Technology Collaborative. Thank you both for being with us today. And with that, I will turn the floor over to Anthony.
Thanks, Tammy. Hi, everybody. All right. So as Tammy mentioned, I'm Anthony DiDonato, the program manager at the Coalition for Health AI, or CHAI. I will talk you through today some of our background. So to just give a quick agenda, who we are. So just an overview of CHAI, our mission and how we work and operate, how we're organized within our different working groups, which I'll speak more about. Then I'll give a little bit more of a deep dive into some of the specific working groups that may be of interest to this community. So ones around our agentic AI, agent skills and guardrail development, ambient AI, post-deployment monitoring, governance and risk, and then highlight some opportunities for the community to get engaged. And then we will focus on other content related to kind of comms and socials at the end of the presentation. So to start, wanted to just offer up Chai's work and who we are. We really like to think of ourselves, and Chai is a nonprofit member-driven 501(c)(6). So we allow our members to drive and prioritize all of our particular work in a given year. The work is really structured in 4 overarching pillars, we like to think of it as: convene, develop, educate, and partner. I'll speak a little bit to each of these pillars. So as a 501(c)(6), again, member driven, we have north of 6,000 subscribers to our larger community, several of which are specific CHAI members. So we have formal membership, we have member organizations, and we have north of 1,000 individuals affiliated to those organizations. Our organizations are multi-stakeholder in nature, so we have health systems from pediatrics to primary care to small rural centers, all the way up to academic medical centers. We have several payer organizations, we have enterprise technology vendors, we have small startups, we have patient advocacy organizations, and we're branching out into the pharmacy community as well. All of these different multi-stakeholders represent our member base and the network that we have within. Like I mentioned, several hundred organizations are CHI members, and we have north of 1,000 individuals. And that really represents our convene pillar. So we convene for multiple purposes. One of which may be the fact that we host conferences. So we just had a conference in Dana Point, California that preceded Health Evolution. We are going to have another conference in October, on October 7th, which I'll share more information about in Austin, Texas. During these conferences, we use it as an opportunity to connect all of our members together. We have roundtable discussions, we have keynote presentations, we have networking events, we have different opportunities for vendors to kind of demo as part of a showroom. All of those opportunities are kind of packaged together during the conferences that we host. We also have more targeted conferences. We have a law symposium that's coming up in October as well in Boston. We've had previous kind of policy focused symposiums, and we're exploring others, again, driven by our membership and their interest. So that's kind of one element of the convene pillar. The other element of the convene pillar directly influences the subsequent pillars here. So the second part is really convening our multi-stakeholder, multidisciplinary member base to start putting together working groups to start developing responsible AI content. So we take convene as an opportunity to pull together like-minded individuals coming together on a particular working group, and then having that working group start iterating over the development of responsible AI content. So that really progresses into that pillar number two around develop. At the highest level, all working groups are tasked to develop responsible AI content. This content can take different shapes and sizes depending on the scope and the structure of a group, like AI governance, like risk categorization, like ambient AI implementation, so on and so forth. I'll get into the specifics of the scopes and kind of what they've been tasked to do. But again, at the highest level, all of these groups are going to be developing and publishing responsible AI content. This content, once released, is always consensus defined and will be made available on our website, on our GitHub repository, and we make it publicly accessible for feedback that way, understanding that all of the content that we release are living, working documents that need to be refined as the field evolves and as we get additional feedback from our membership. Once content is developed, we then transition into that third pillar around educate. So we take the content that's been developed and we use it for educational purposes. We may attend other conferences to kind of showcase what's been released. We will put it out, like I mentioned, on our website and our GitHub repository and other mediums for folks to access and review. And then we also use it as an opportunity to build and put together different education platforms for our members specifically. So while the content itself is publicly available, some of our membership value adds are around education portals, such as more user interactive and friendly features for governance, for risk, and other tools that can support that larger education component. And then lastly, for information and content that Chai recommends but can't internally do ourselves, we work with and vet against third-party organizations like governance platforms, data management platforms, testing and validation services, and understand what functionality they offer that can contribute to some of the recommendations that Chai suggests in our published content. So when we're thinking about responsible governance, working with governance platforms in this space and pulling them into our partner ecosystem that represents the kind of entire set of self-attested vendors that are currently available to date that contribute and have the functionality to better inform and allow organizations to align to responsible governance, risk, etc. But that partner ecosystem, which I can touch on a little bit more, is that last pillar of work that we operate under. And while I'm talking, feel free to drop questions in the chat and I can get to them after the presentation. So like I mentioned, we as an organization have been around since the end of 2023 when we released our Responsible AI Blueprint, which really focused on a core set of principles. So when we think of responsible AI, that's really in reference to usefulness, usability, and efficacy of responsible AI tools and solutions, the fairness and equity of those, the safety and reliability, transparency, privacy, security, all of these are kind of rolled together and represents Chai's core principles. We use the principles as the foundation for all of the work that we develop thereafter. So that might be around our consensus built guidance, like some of our responsible AI checklists, our responsible AI guide, some of the more technical frameworks like our governance framework and associated playbooks, our use case specific best practice guides and testing and evaluation frameworks. We have tools and resources like our risk categorization tool, a literacy program that we're developing, model cards, and then those are all kind of wrapped up together within our Chai partner ecosystem and our public health AI registry. So, really moving from principles to practice, and the underpinning of all of that we do are these core principles, and it's represented in many different ways, the guidance, the frameworks, tools, and resources in these platforms. So, this is just a diagram that represents how all of the working groups and their content are kind of interaligned with one another. So to get more into the specifics of how we operate, currently we have active working groups and upcoming working groups, all of which you all as the community members of Chai are available to join either as an observer or as a contributor. So as I talk through all of these working groups, just keep that in mind where if you're not necessarily an expert or don't have a ton of knowledge around a particular work group, but are just interested and would like to observe, we absolutely welcome that pathway. If you are more of an expert and would like to kind of provide your thought leadership and knowledge in a particular group, that contributor role is also very welcomed. The working groups that will be active starting this month in July and will continue on through the end of the calendar year, end of December 2026. We have two types of groups. So I'll start with the use case working groups and then I'll drop down to the cross-cutting. This top row right here around the use case working groups, we have four, two of which that have been active since the beginning of January and will continue through December, and the other two in blue, which will be launching in this quarter. Going left from right, we have our Agentic AI working group. The group so far meets bi-weekly for 1 hour. And during these calls, they are a series of presentations. We have facilitated discussions. We have surveys. We review draft materials. All of that is centered around developing healthcare specific protocol language. So right now we understand that there's a gap in the field. While there are protocol languages like MCP and A to A that exist and are widely adopted and well used, however, there isn't healthcare specific language that kind of supplements a lot of what's being proposed in those protocols. So, what the team has been doing to date is introducing a set of use cases, whether that's voice agents for patient scheduling, whether that's contract searching within a health system, whether that's pre-visit note summarization, and within the context of those use casing, identifying gaps where protocol language don't currently exist that would better enable the performance of agents that are operating in these use case working flows. So we've been iterating over those specific priority work use cases that I mentioned. What we're planning on doing in the back half of the year is introducing new use cases to understand the additional healthcare protocol language that should be included. So the opportunity would be potentially working through pharmacy specific use cases and understanding what those gaps are, and if we can start coming to consensus on protocol that would support those particular use cases themselves. The second group that has been active, that will remain active through the end of the year, is around our ambient AI. The group so far has been developing an implementation playbook. So this is a vendor agnostic implementation playbook that is evidence-based and is derived from learned experience from the health systems that have been deploying ambient AI to date. So we've had presentations from pediatric health systems, community health centers, all the way up to AMCs, talking through their lived and learned experiences, deploying and implementing ambient. What we've done, and we've kind of oriented ourselves around our governance structure. So when we think from procurement, pre-deployment, piloting, deployment, all the way through monitoring, what are those implementation considerations that should be teased out and consensus defined and then represented in this implementation playbook? The playbook itself has that consensus content of guidance considerations, but we also have real world examples that we offer up in support of the particular best practice statements that we have in the playbook. We have other notes, we have resources, tips, all of that, which is packaged in this first version of the playbook that we just released actually last week. What we've been doing in the back half of the year, similar to Agentic, is introducing new use cases. While Ambient so far has been focused on largely the physician persona. We want to introduce more use cases for nurses, for behavioral health, additional ones for pediatrics, as well as pharmacy, and understand and build the maturity around this playbook to represent additional use cases there. The two new use case groups that are going to be launching later in July are around program integrity. So this specifically will be focused on developing consensus guidance that organizations can apply to reduce improper payments, administrative waste, and avoidable disputes, and understanding the pain points, those gaps, and then building consensus around proper guidance from both the developer persona and then the implementing organization of these AI tools. And then for the post-deployment monitoring, which will also be launching in July, the focus for this will be developing consensus guidance on AI monitoring practices. So this will include content like, responsible auditing, logging, appropriate transparency metadata that organizations should be considering, all of which will be supporting the operational oversight to support ongoing performance and compliance under this post-deployment monitoring umbrella. So both of those will be launching later in July, and we'll be onboarding and having a kickoff call that will represent more of that content later in the month. Dropping down to cross-cutting working groups, we have 4 that are active that will remain active through the end of the calendar year. So we have a legal group that really represents lawyers from health systems, from enterprise technology vendors, from payers, and they really focus on pertinent legal implications that are bubbling up as priority in the field. So the discussions around what those issues may be is really the focus of that legal working group. Similarly, the policy working group, which represents a lot of policy analysts and other like-minded individuals in pulling together policy-specific content. One example is the release of our transparency report, which represents both state and federal patient transparency laws that are both being proposed and have already been put out in practice across the US. So that transparency report is publicly available on our website, linked to it in the subsequent slides, but that's just an example of the policy working group and the type of content that they talk through and discuss as a team. The risk working group focuses on categorizing risk of AI solutions pre-deployment. So we have an interactive tool that helps organizations navigate how to categorize risk. And that has been the focus of that team the first half of the year. We just released that tool, and it's also available on the website, linked in these slides. The back half of the year, we're going to be focusing on aligning categorization of risk to appropriate risk mitigation controls. So once an AI solution is categorized as low, medium, or high across the modifiers that we have within this tool, it will start triggering mitigation controls that organizations need to consider. So there'll be mitigation control statements and then suggested ways to implement that control based off of the organizational size and maturity and working through what that set of mitigations should look like. And then lastly, for the active cross-cutting groups, we have our AI governance playbooks. We released these at the end of May. The governance playbooks are primarily for a health system audience. This was in partnership with the work we did with the Joint Commission. The governance playbooks, which represent each of the domains within our governance framework, domains being AI policy, organizational structures, organizational resources, et cetera. Each of those domains has a governance playbook that we worked with several hundred health systems on in developing that content, implementation guidance, further contextualizations, real-world examples, tools, and resources, all packaged in a playbook, each playbook representing each of our governance domains. Those playbooks helped inform the Joint Commission's Responsible Use of AI in Health voluntary certification program. And we're going to be continuing to work with them to gather feedback once health systems get certified to help inform and improve subsequent iterations of that voluntary certification. But the playbooks that we released on our own are available on the website, and they represent a lot of what's in the certification, but what we feel within CHI is appropriate responsible AI governance. In the second half of the year, what we're focusing on for governance is going to be around leveraging the foundational material that we created within our governance framework for health systems and repurposing some of that for our payer community. So we're going to be creating similar playbooks for our payers as the primary audience, both of which will be wrapped up close to the end of the calendar year. And then the last two, which will be launching later in Q3, we have a work group on cybersecurity. The goal of the cybersecurity work group is to assess the offensive capabilities and threat landscape associated with frontier AI models. And in that analysis, developing guidance to help organizations strengthen defensive cybersecurity controls and resilience against emerging AI-enabled threats. There's a lot of foundational work that has been published recently, some of which is with the Health Sector Coordinating Council, the HSCC, released a cybersecurity playbook. We'll be working jointly with them in leveraging kind of the content in that playbook and understanding based off of these capabilities of the frontier AI models, how we can start adding more healthcare focused guidance. So that'll be the primary focus of the cybersecurity group, at least to start in the back half of this year. And then very lastly, before I move to the next slide, the last group that we'll be launching later in Q3 of this year is around human flourishing. So really, this group is tasked to understand how we can build out guidance for organizations when evaluating models' alignment to human values. So when we think through like religious values, other types of values, what does that evaluation and kind of framework look like that AI models can be evaluated on, and that organizations can understand how to go about their evaluation before implementing internally at their institution. So that's kind of the general theme with our Human Flourishing working group, again, which will be launching later in Q3. So to give a little bit more color commentary to some of those work groups that I just listed, because I know there's a lot that might be of interest to the pharmacy community. The first one here is again around our agentic AI working group. Like I mentioned previously, what we're building is this consensus-based healthcare protocol language. So quite simply, shared expectations for how agents should behave within healthcare. So far, this healthcare protocol language has been applied across those priority use cases like that I mentioned. So voice agents, clinical decision support, pre-visit note summarization, and contract search. And really, the opportunity, I believe, for PQA and our larger pharmacy community members is to bring these and other pharmacy use cases into the Q3, Q4 2026 conversation. So having presentations either yourselves, if you're building these agents and would like to share those with our community members, learning from other presentations and building out this protocol language and the consensus process around it together. And then I've listed just a couple example pharmacy use cases that might be of interest to the team within this agentic working group. So, some of which may be medication adherence and refill reminder voice agents, CDS for drug to drug interaction and dosing checks, so on and so forth. So, several example use cases that I think would be very relevant to the agentic group. And if folks on this call have ones that they'd like to surface and join that group, please let me know and we can figure out, what that presentation or just general discussion may look like. Another opportunity, more specifically, is around our agent skills development. So, this skills work supports what we've been doing in our agentic working group, the broader working group. Agent skills themselves are working on developing a set of skills and guardrails, which really simply are scripts, narrative examples. These might be, pointers to reference implementations, HL7 implementation guides, any other thing that can add additional guardrailing and structure to how an agent can operate in a given workflow. So the skills themselves support the protocol language that we're receiving consensus on. And what we plan on doing is once we have a repository of these skills and guardrails, we're going to publish them on our repository and then begin testing their performance in an evaluation environment that we're also spinning up. So understanding how an agent performs with or without a particular skill across a particular use case scenario. An example of this is the development right now that the team is working on in patient context transfer. So you could think of an example where there's an agent skill for how an agent is able to share specific patient information when transferring that information from one agent to another. That might be a prior authorization use case. That might be a note summarization use case, ambient AI. There's several examples for how this skill could be applied. But the content within that would be the guardrailing and the restriction for what an agent is able to share for that patient context transfer of information. So the opportunity, I think as an example for the pharmacy community would be to help co-develop and test additional pharmacy relevant skills and guardrails. So that patient context transfer skill, as an example, may be applicable to some of the agent workflows that you're operating in, and we would be able to test performance of that skill in that use case. Or if there are net new skills that are, more pharmacy specific, we can include those into our broader repository and then begin testing within this evaluation environment with all of the members that are contributing to that. Another one I wanted to shed a little bit more light into is our ambient AI working group. Like I mentioned, this team is building this vendor agnostic implementation playbook for deploying and using ambient AI. Thus far, it's been grounded in real world settings, from pediatrics to AMCs. There's been examples around use of the ambient in the emergency department, in pediatrics, behavioral health. There's been a couple in nursing. But I think the opportunity here would be to expand the use of ambient into additional pharmacy settings and understand how that implementation playbook would be modified based off of those use cases that are presented to the team. So that could be, again, from your learned experience presenting or just offering up your perspective in the broader discussions to help influence that implementation playbook content. Another one that I wanted to mention is around post-deployment monitoring. So again, I mentioned this team will be developing consensus guidance on AI monitoring practices. We really want to focus on once AI is introduced in an organization's workflow, how it can be better audited, logged, the specific transparency metadata that needs to be surfaced and pertinent across a workflow, and understanding operationally how organizations can begin achieving that. So those are going to be the focus of the monitoring working group. And again, opportunity for the pharmacy community, which be just directly helping and getting involved in those discussions and developing the monitoring best practices. I don't believe, and we don't believe as a community, that this is stakeholder specific. I think a lot of these AI monitoring practices apply across health systems, payers, pharmacy. So working together and understanding what those look like, I think will be a wonderful opportunity once we do launch this group later in this month. And then very lastly, I think there's again strong opportunity around the governance and risk work that we're doing. The AI governance working group, the released consensus built AI, 8-part AI governance playbooks are already available on our website. So if folks within the community would like to review those and share feedback with how subsequent versions of the playbooks could be updated and changed, please let us know. We have a feedback form that will capture all of that. Also, if you'd like to start applying some of the recommendations within these playbooks at your own institutions, we offer these playbooks as a voluntary suggested set of information for folks to start orienting themselves around safe and responsible AI governance. So while it is focused for the health system audience in our partnership with the Joint Commission, a lot of the information is more broadly applicable to other stakeholder audience as well. So if you'd like to review those are available, as well as continuing to join conversations, whether it's the payer AI governance playbooks that we're developing in the back half of the year, or exploring what additional opportunities for a pharmacy-specific governance playbook could look like. We're very open to working with you all as new community members and understanding what that might look like and how a new work group could better support those interests. And then very lastly, like I mentioned with the risk work, we have a risk categorization tool, the third version of that was released just yesterday, actually. So if you'd like to give that a review and start using that within your own risk review processes, let me know, and I can kind of help orient yourself to the tools and figure out how to best implement it within your current workflows. Additionally, if you'd like to get involved in the current discussions around those mitigation controls that supports the categorization of risk, that team is actively meeting. We have a call right after this, actually. We're going to be building out what that mitigation library looks like and start putting together implementation practices for those mitigations that we receive consensus on. So I think just generally, again, opportunity here is joining the discussions and start aligning the organizations to our governance and risk processes that we've kind of consensus defined thus far, and we'll continue doing so within our working groups. So to just kind of summarize how PQA and its members can engage, a couple overarching points. One would be to share use cases. So across the working groups that we have, whether it's agentic, ambient monitoring, governance, et cetera, bringing forth some of your use cases that we can discuss with our broader membership, or if you just like to apply the perspective that you have within a use case to our ongoing discussions, I think that is very well suited as well. There's also the opportunity to build and test, and apply your expertise to our agent skills subgroup. So again, this GitHub repository of skills and guardrails that will then be used within an evaluation environment to test performance. If that's of interest, bringing forth some of your use cases there, potential skills that you've already been building, and we can build and test together within the working group. And then very lastly, continuing to shape and refine the guardrails and frameworks. So contributing and being part of those discussions will help further our consensus across all of our working groups, and having your perspective will kind of further perpetuate some of those, the shaping of those guardrails and frameworks. And then very lastly, just wanted to highlight some events that we have upcoming, and how you can join our communications channels. So upcoming events, two to note, we have a calendar on our chai.org website. So just chai.org/calendar. Again, also these slides can be shared after the call. We do have two confirmed events so far. The legal summit that I mentioned is September 17th in Boston, Massachusetts. Our fall symposium at UT Health will be on October 6th in Austin, Texas. Registration and more information about the agenda will be made available soon. We're still drafting that up, but once it is available, the registration will be on that calendar page on our website. And then very lastly, for our Chai comms, to join our general newsletter to receive any and all Chai related updates, please go to our main homepage, scroll to the bottom, and there'll be the opportunity to subscribe to our newsletter. So you'll receive all of those specific updates. For our Chai member forum, if you are interested in specific working groups, we house all of our work group materials. So the meeting recordings, the presentation slides, the surveys, the draft materials on our member forum hosted on Discord. So once you select interest in particular working groups, I, on the back end, will be able to onboard you by sharing the meeting invites. I will give you access to our Discord and the channels for each of the working groups. And then you'll have access to the previous materials if the group has already been active, or any new materials once we launch the work groups that I mentioned in the previous slides. I think with that, I will pause. That's all of the information I wanted to share initially. If there are questions around any of the working groups, I do have additional slides in the appendix that we can get to at the back half of the call. But thank you guys for your attention. I'll turn it over to Jeff, and then I will look for any questions, comments in the chat. But thank you again. And Jeff, I'll turn it over to you.
Thank you, Anthony. I really appreciate it. Can everybody hear me? Just good? All right. Well, appreciate all the detail, Anthony. And I just wanted to supplement some of the thought process around pharmacy and the use of AI and the integration of the framework that Chai has put together within the growth of utilization of AI in the pharmacy circles. My name is Jeff Rochon. I'm the Executive Director for the Pharmacy Health Information Technology Collaborative, or PHIT. It's been my honor to be a part of PQA's leadership for a number of years that predate even my time with PHIT. And the honor of being their board chair this year. So this is a great convergence of opportunities here. I have to say that the reason that PHIT and myself first became aware of Chai was because of a PQA Convenes conference last November, where Lucy Orr-Ewing, the Chief of Staff and Head of Policy for Chai, gave the keynote. And with the assist from Mike Acosta, CEO of PQA, I was able to have a conversation with Lucy, which led to conversations with Anthony and his colleague Mirage about how we can, as a profession, become a part of these conversations. So thanks to PQA for making this connection. We are, in general, PHIT is a very similar sort of convening body to Chai. And our members, we started in 2010, and our members were Strategic members are many of the major national associations, and some state associations have joined the mix, and as well as PQA as a prominent associate member, and SureScripts, NCPDP, and others here that have contributed to our work in the HIT arena. Partnership is a huge part of what we do, and we've got a great list of partners as well that CHI is now a prominent member of, as we work to make sure that our pharmacy-specific conversations are integrated into the conversations that surround the rest of the health technology ecosystem. And we're excited to work with CHI on how we can better get pharmacy use cases into their current work groups. As a side conversation, and I don't know that we really touched on that, but we did discuss early on about just having a pharmacy work group. And I think that this partnership bent and the conversations surrounding what Anthony just described in their work groups, it didn't seem that a pharmacy-specific work group really fit in. And I think it behooves us as a profession to integrate into their existing work groups with pharmacy specific use cases that one can bring the awareness to other healthcare providers about what's going on, but we can also learn from what's going on with them. And so I really like the way this is playing out with our ability to integrate into the existing work groups that Anthony just described. So similarly, we do convene and develop, educate, share, and advocate in addition to our partnership, so that there is a very similar sort of process. So it made it a natural partnership with CHI. But I would say PQA has been heavily involved in these conversations, NCPDP as well, and others have said, "Hey, how can we participate?" So in the examples shared, it made perfect sense for PHIT, one of our work groups, to be a portal into this work, and I'll help describe that here. Just a little bit about our history, real quickly. We were built as a collaborative in 2010 with the idea around how do we get our health information technology without meaningful use dollars, without some of the other things afforded to other providers. How do we get to a place where our data is going to be interoperably shared, and that we're going to be able to embrace all the advances within the health technology ecosystem? And so as we look at moving forward, we're looking at AI, automated pharmacy workflow efficiencies, real-time population health, seamless integration into the evolving digital health ecosystem with our watches and phones and all the other digital health data that's out there. And then we network with our forward-thinking organizations to make sure that we're committed to this, and we're positioned in appropriate places to be digital health leaders. But these traditional pharmacy practices are evolving, and we need to understand that these technologies can increase efficiencies, but there are the caveats that exist, and that's why we think this partnership with CHI and their responsible and trustworthy AI core principles are crucially important, and we can align with them. So just looking back at some of the stuff that PHIT's done over the years, I just joined PHIT about a year and a half ago, but Shelley Spiro and a great host of volunteers in our working groups have created a number of documents guiding the profession and stakeholders in numerous areas, including 2024 AI primer from one of our work groups that has continued to work in this space, and I'll get more into that soon. We also advocate and contribute to collaborative outreach, requests for information, and other comments on rules with ONC, CMS, HHS, and a number of others, and those are sent out through our membership. We, as PHIT representing the profession, appoint advisors to the American Medical Association's CPT editorial panel, which has created a great relationship with the coding that goes along with medical billing. and ensuring that pharmacists are appropriately included in some of those CPT codes so that they can bill in team-based work and value-based programs with appropriate attribution. And that has evolved with the leadership of Brian Essex and Dan Buffington and others that have really opened up a great symbiotic relationship with that group where pharmacists are a part of the conversation and not a competitor. And I think that's a really valuable asset that PHIT has brought to the profession. There's in the efforts to make sure that we had the right tools to be interoperable, we had to build some standards and get those published, and that's a great deal of work. And so we partnered with NCPDP and worked with HL7 and some consultants that work in this space to create 3 pharmacy-specific formats for FHIR and CCDA, which is a consolidated clinical document architecture, which is essentially like a digital PDF that we can share. And that allows us to have the right formatting for interoperability and a key tool in that. In addition to that, there are some terminology, standardized terminologies or a specific language that our data needs to be translated to be consumable or received by the parties we're sending it to. And so PHIT stewarded, with the help of a value set committee that was formed a few years back, more than 500 SNOMED CT codes and 100 value sets, and published those in the National Libraries of Medicine, VSAC, or the Value Set Authority Center. And that is crucial because those are now recognized codes for our terminology to be translated to for receiving and sending of our data. And then my predecessor co-chaired the ONC's Health Information Technology Advisory Committee, or HITAC. They had a pharmacy interoperability and emerging leadership therapeutics leading therapeutics group that led to a final report to the ONC. And that ONC report included 34 recommendations that they approved. And so the ONC has a grid beat on that, the needs of our profession, and that was championed by Shelley Spiro and a gentleman from Oracle were the co-chairs, but a number of the pharmacy leaders were a part of contributing to those recommendations. So a lot of great work has been done. As we look moving to the future, you can see that we've strategized four main goals, and I'd like to highlight number 2, which is the digital transformation and AI and integration component, because that's what we're going to be focusing on. But we also look at interoperability, the quality and documentation components, and the policy and advocacy. But let's focus in on empowering the pharmacists with trustworthy AI tools built on standardized data models and terminologies that keep humans in the loop and amplify our clinical experience. Within our work groups, we have 3 work groups. They are, as I mentioned, the Pharmacy Systems Interoperability Work Group, and we have a Pharmacy Service Coding and Documentation Work Group. Those 2 work groups are doing great work. The Interoperability Work Group is about to publish a QHIN, a Quality Health Information FAQ, to demystify what's transpiring with TEFCA and the way that we can get it integrated into these national networks for data exchange. But they'd previously, last December, published a pharmacy-specific review of the ONC's EHR-based certification criteria. So the criteria for all electronic health records, the functionality necessary for meaningful use and to be certified by the ONC. We wanted to take a look, even though pharmacy didn't have the meaningful use dollars, we want to know where we need to be in order to be interoperable. And so they did a review of that and published it. Now we're working on QHIN. The next step for this group is to review a checklist of our pharmacy vendors, technology vendors, checklist of what they need to have for functionality to include the EHR, ONC stuff, but other components necessary for our profession to be interoperable. And our Pharmacy Services Coding and Documentation Work Group is about to publish a primer on the health information technology needs in value-based programs, which I think is exciting, and we're about to publish that. But let's get into our clinical workflow AI and Digital Innovation Work Group. This work group consists of a newly added tenet of AI and digital innovation, but has really been focused on the clinical workflow for the last few years. And that clinical workflow it embraces the AI and digital innovation components, but it also presents us with an opportunity to dive deeper into that area, and that's what we're doing now. So we're really looking at ways that this work group can advocate for AI governance frameworks and facilitate training programs for pharmacy practitioners, establish innovative partnership with technology vendors and folks like CHI, and identify AI tools to improve the clinical workflow efficiencies. And so it really naturally kind of fits in this space that we will be partnering with CHI in the work group moving forward. The last thing that we published, I mentioned, was in this group was the artificial intelligence considerations for pharmacy, and they're about to publish a overview of the pharmacist's role integrating digital health and AI technologies, which is inclusive of a joint commission of pharmacy practitioners, patient care process, AI use case. And that AI use case is walking through the JCPP patient care process and identifying where the appropriate use of AI could be utilized to increase the efficiencies of patient care and more streamline our approach to collecting the data and sharing it bidirectionally within these healthcare technology ecosystem. One of the things that we're looking at is, and this is something that I know Anthony's work groups are looking at, is just how much of the human in the loop enforcement is in judgment is integrated into these solutions. And so this visual kind of helps us outline a little bit about how integrated the human element is into some of these. And I can tell you that at the AMA CPT editorial panel, there was a lot of discussion on how that is going to be embraced with some of these CPT codes moving forward, as a number of folks presented AI solutions to them. And they went as far as trying to define within their CPT framework, the editorial panel framework, some of the assisted and augmented AI and autonomous AI components, but you can see that the assisted and augmented AI are a large component of the initial use of AI because they have more human control embedded into them. And as we get into these others, that's where these responsible and trustworthy AI framework that CHI has embraced with their usefulness and fairness and safety, transparency, and privacy aspects will be crucial as we look to evaluate how we can use these safely and effectively. So going back to our work and how we do things at PHIT, which is similar to CHI, we are convening folks within this group to develop some use cases, thinking of it as a pre-CHI sandbox, if you will, for us to bring some of these thought process to table and to refine them and even adapt them to how CHI typically integrates use cases and prepare them so that we can develop them and educate and share them, and then join in some of the advocacy efforts around the governance that CHI is working through. So we'll be jumping into this. Excited to be a part of it, but we're going to explore, discuss, develop, and refine some AI use cases that are relevant to pharmacy workflows in the patient care provision, as well as in the medication provision, as a lot of the examples that Anthony had presented would align with. And then we're going to work with CHI to adapt them to their work groups and their worker processes and help support them throughout the cases. And then we will disseminate that to the rest of the profession and stakeholders and help to educate the safe use. So we're excited for this work. I don't want to leave us without time for questions, but I do want to welcome you all to join us as a membership organization. If you are a member of any of the groups like PQA, then you have an opportunity to participate in our work groups. And if you want more information, my information is below. So with that, I'll turn it over to Tammy. Thank you so much for your time.
Thank you. Thanks, Jeff. Thanks, Anthony. And thank you for sharing these collaborations between Chai and PHIT. I think it's really important to remember and note that this happened quickly. This partnership happened quickly. And it's looking like a beautiful thing. So I do have a couple of questions here, and knowing that we've got only about 10 minutes or less, Anthony, many organizations recognize the need for AI governance, but they're at very different stages of implementation. What are some of the biggest misconceptions or mistakes you see organizations making as they begin to establish AI governance? And what advice would you offer to those just getting started?
Yeah, no, thanks, Tammy. A couple points there. The first one is, I think one misconception that we can better approach as we think through these governance playbook materials is thinking with the end in mind. So, really understanding the entirety of the governance workflow from procurement and AI intake at the onset all the way through monitoring, and how that understanding influences some of those other governance components. So, like I mentioned, there's the AI intake where you're introducing a new AI solution, whether you're considering it during the procurement process or once you've just adopted it. It's how that then influences the pre-deployment and the piloting, how the piloting kind of evaluation and assessment influence how you're going to deploy, and what information you need to be considering along the way that will enable success for monitoring. Like I mentioned, some of that transparency metadata, whether there's certain metrics that have been established during those piloting stages that you have monitoring mechanisms in place to better evaluate and support. All of that, I think, contributes to the larger kind of governance evaluation and keeping the end in mind.
Yeah,
The other
great.
thing, just to quickly mention, is
Yeah.
it's not a one size fits all approach. So I think,
Mm.
some organizations feel a bit overwhelmed when, they receive some of the playbook materials that we share, but we understand that there's many different ways that organizations can align to some of the controls that we're proposing. So very simply, one of the initial controls that we have in our playbook is around establishing an AI policy, right? Understanding what information needs to be included in that policy may vary based off of the maturity and the size of the organization. But at that very, very highest level, a policy should be included in your larger governance practices, but the content within can be massaged based off of the need of the organization. So never a one size fits all. All of those perspectives are represented in our governance playbooks, and we want to be mindful of that and definitely advocate for it when we talk through governance.
Yeah, sounds like the playbook is ripe with good material for us.
Yeah, absolutely.
Jeff, from PHIT's perspective, where do you see the greatest opportunity for AI to improve medication use quality over the next 3 to 5 years, or longer if you feel longer? Are there particular workflows or decisions where AI would have the most impact in your perspective?
Wow, that's a great question, Tammy, because I think that there's a number of different areas where we can embrace this in a way that is safe and effective, but that there's obviously a number of adoption components that are necessary. I've heard from companies that if things have AI involved, it can be a 9 to 12 month process to get them where they need to be. But I think data validation and checks and balances with some of the translation things that AI can do agentically, the ambient collection of data for patient care. I think documentation is the toughest part of some of the pharmacies' transition into care provision. And without that documentation, then that data from their intervention is not shareable and not consumable, never happened. And so from a pharmacy use standpoint, the more data we can collect about what the pharmacist is doing in their care provision and education components and be able to share that. Most community pharmacies are pretty much on an island, in many ways because their pharmacy management systems aren't interconnected, and we're working heavily on that interoperability component. But with the ability to collect that data, with voice recognition, ambient kind of technologies, that feeding of that data really proves the value of what pharmacists can do and integrates them. It gives them the data to support integration into teams where they can really help with the medication use and not be out on an island with a bunch of education that is not utilized within those healthcare teams. So I think there's tremendous ways. In the research and quality measurement standpoint, I think it can be heavily utilized. And I know that PQA is looking at that as well. And so depending on what hat you're wearing, I think that there's a number of ways that this can really work. PHIT's been really honed in on pharmacy provision of care. And so as we just were looking at that patient care process, just looking at the ways that interoperability and the use of AI to pull in data so that you have the data available at point of care and help that collect. And then with the sharing and dissemination of that data to other providers and to plans for quality measure components, that component right there elevates the focus on what pharmacy provides to moving those measures in a meaningful way. So I think there's a lot of potential there, and I do think it really coalesces with our efforts to interoperably exchange data in the ways that the entire health technology ecosystem is trying to achieve at this time.
Yeah. And, for a profession, I'm also a pharmacist, and from a profession that really loves and needs and likes to have that data at our fingertips, it's been challenging to capture it all. So I appreciate that a lot. I am going to move into a few announcements here. So thank you very much for your time, gentlemen.
Thank you.
Thanks so much.
All right. Let me get our slides back up here. First, our next webinar. Oh, hold on. There we go. Our next webinar is coming up on Thursday, July 23rd at 1 o'clock. This will be a listening session about the legal actions, recalculations, and impact on quality medication use of the Clover Health versus Department of Health and Human Services lawsuit. This session will be open to members only, and registration is open, and it can be completed at this link. It is in your chat. We have a few more webinars coming up here very soon. So our next quarterly, regularly scheduled member webinar will be held on Wednesday, July 29th at 1 o'clock. And our next quality forum will be on Thursday, August 6th at 1 p.m. During that August webinar, we will hear an encore presentation from Arene and Cambia Health Solutions, who presented their work on AI use in value-based care at our annual meeting in May. Registration for both of those events is open, and they have been put into the chat here. And then last, our registration will be opening soon for our PQA Convenes and 2026 PQA Leadership Summit, both of which will be held in Arlington, Virginia. PQA Convenes will take place on November 5th and will be a workshop focused on appropriate use of the medication therapy problems categories framework. The Leadership Summit will take place on November 5th and 6th with a focus on the Pharmacy Quality Recognition Program. Be on the lookout for registration information in your emails, and we look forward to seeing you in Arlington. Thank you all for joining us today, and have a great day.